My name is Molly Shar, and I am the Executive Director of NSGIC. I'm very pleased to be kicking off today's webinar on the extremely important and timely topic of the distribution of the forthcoming COVID-19 vaccinations in the context of GIS. And our hope is that this webinar will be a jumping off point for a larger NSGIC discussion about how state GIOs and other GIS specialists in state and local government can provide leadership in this monumental effort to save lives through efficient, effective, collaborative planning and communication. Many of you on this call have been participating in ongoing discussions about the COVID-19 response, and I especially want to thank those who have participated in the work of the National Pandemic GIS Task Force, stood up by NSGIC, NAPSG Foundation, and ERISA. Frank Winters, GIO of New York State, and Tony Speedy of the state of Missouri have represented NSGIC on this task force, and there will be some really important resources coming out of that collaboration. Today's webinar is being recorded and it'll be made available to the NSGIC community in the coming days. You can also expect to receive more information about follow-on discussions. So it's now my honor to introduce Dr. Este Geraghty, Chief Medical Officer for Esri. Dr. Geraghty has been a leading voice in the effort to leverage GIS for the pandemic response and is here to share her insights into the approach for vaccine distribution, as well as some of the tools and resources Esri is making available for this Herculean effort. Este, thank you so much for being with us today. I'll go ahead and just turn it over to you and your colleague, Mike.
Thank you, Molly. I appreciate that. I'll go ahead and share my screen. And if folks aren't seeing it by just about now, please do let me know. So it's good? Okay. So I want to start by thanking you for your time today. I know that everybody's time is we're used to being crunched this year. It's been quite a year. And we want to focus on this very important topic of vaccination. It's an area that I think provides all of us nowadays with a good deal of hope that the end of the pandemic may be near, but at the same time, it's presenting us with this vexing challenge. It has been said that providing equitable and speedy vaccine distribution for COVID-19 constitutes the largest and most complex vaccination campaign in history. It's quite the grand challenge. And so over the next hour, Mike and I want to show you how GIS can support you in this enormous effort. And our approach really breaks down the effort one step at a time. It brings, I hope, I'll let you be the judge, some clarity and simplicity to the challenge, which is why I really liked this quotation, not to mention it had the word antidote. And I thought, okay, vaccines and antidote, it really all makes sense. So using GIS and location intelligence technology, we're going to walk through 5 key tasks, starting with the identification of facility or vaccine venue candidates. Because of course, there's going to be some differences there in who can be a vaccine venue. Then we're going to talk about identification and prioritization of your jurisdictional, your state populations for the phasing process. Once those vaccine venues are selected and the populations are phased and mapped, that's when you're able to determine where there may be gaps in access to vaccine. And that's when you can plan outreach for those hard to reach populations. The 4th key task that we'll cover today is to track and manage vaccine and supply inventories. And finally, it's going to be important to design effective communication programs for the public, for your stakeholders, and for targeted messaging to vaccine hesitant populations. So I'll spend a little bit of extra time there. So we know that there are, of course, many healthcare facilities that commonly deliver vaccines of various kinds throughout the year to adults and children alike, your flu vaccines, your measles vaccine. This includes hospitals, right? Clinics, pharmacies, among several others. But in consideration of the current SARS-CoV-2 vaccine candidates, there will be additional criteria, like the ultra-cold storage requirements, which, as you all know, it limits the facilities that are going to be able to store and administer particular vaccines. And mostly I'm speaking here of the Pfizer vaccine. Further, we think about a facility's capacity to deliver vaccine. We need to think about other factors and understand them, like access logistics. What is the ingress and the egress for maybe considering drive-through vaccination clinics? Or what does the parking situation look like? The facility size, an indication of their capacity, the staff that can deliver it, and nearby traffic conditions, because we don't want to increase frustration during an already frustrating year. We also want to identify additional vaccine venue candidates for the later distribution phases, because that's when we really expect that there's going to be a surge in both the vaccine supply when manufacturers have had time to make enough, and an increase in demand. In other words, the phases open up to broader populations. So both of those are likely to increase dramatically, probably toward mid to end of first quarter next year. And at that time, we're going to want to be able to include other candidates to deliver the vaccine, like maybe it'll be work sites, senior centers, retail settings as new potential delivery sites. Now, the second key task that we're talking about is to identify and prioritize populations. And this task is really about equity, and it's about making the best use of our limited resources, especially in the early phases, because that is actually what will end the pandemic as soon as possible. So it really requires knowing how many people in your state are in the various phase groups and where they are. Now, I want to consider, for example, the critical workforce, because this one has really been a challenge for a lot of jurisdictions. And I know you guys probably know some of this, but with geographic data, you can dive in so much deeper. And Esri does collect over 15,000 data variables, from demographic data, which is incredibly useful, to business and spending data, to lifestyle data, all of which can support some of this kind of work. So in this case, what we're showing you is an infographic that was created really quickly. It can be done in business analyst or community analyst, related to the civilian labor force. And it's a two-pager. So if we're thinking about critical workers, you can start to figure out how many personnel are working in healthcare, in agriculture, in construction trades, whatever it is that in your jurisdiction has been classified as a critical job title. You can look at any geography, as you well know, from city or county to zip code or census tract. That's all incredibly easy, but you can also use custom geographies that may be of interest. Imagine things like everyone within a 30-minute drive time of a hospital during peak traffic, or people within a 15-minute walk time of a pharmacy. So you can really get that localized insight when and if you need it. And Mike is going to be showing you all of the live demos, the interactive tools, and I think that those dynamic tools are likely to be the go-to resource for thinking about population phases. But we all know that sometimes you just need an infographic to put in a report with the data when you're talking to various kinds of stakeholders. So we built this infographic to show the numbers of people in each of the CDC's suggested phases from their interim playbook. Of course, it can be configured to any of the state plans. And so the key point then I think is that the infographics are pretty simple to create. So the third key task really makes use of those first two tasks. So knowing where the facilities are and where the phased populations are located. Because once you have those two pieces of information, you can begin to assess for gaps in the access to vaccine, and you can start to do something about it. So what might you do? You might cite new points of dispensing. using the process of location allocation to help you really ensure that any new sites will serve the greatest needs based on whatever criteria and budgetary and staffing constraints that you have. One of those criteria, actually, according to the National Academies, who built this consensus report that describes the framework for equitable allocation of COVID-19 vaccine. They didn't do very well on a concise title, but that is what it is. They talk a lot about the CDC's Social Vulnerability Index. And if you're not already familiar with that index, it combines 15 measures of vulnerability across 4 life domains, like housing and transportation vulnerability, or language or income vulnerability. So you've got these different areas that you can disaggregate and measure individually, or you can use it all together as one index. And that has been geo-enabled by the CDC and made freely available at the census tract and county level on our website on the Living Atlas. Now, what else could you do? You might examine other potential solutions for outreach when you find those gaps. It could be mobile teams that can vaccinate hard to reach populations. And some you're probably going to have to use mobile teams for. Think about your most rural populations or tribes or people experiencing homelessness. And there may be other groups who are unlikely to come to a clinic to get a vaccine, and you really need to go to them and meet them where they are. Now, this is really just a simple overview, stuff that you already know, to show you the location allocation workflow. So just to describe the idea behind this is you load in all of your candidate vaccination venues. Again, I'm thinking about the later phases of vaccine distribution when we have that surge in supply and demand. So new vaccination venues where you can reach harder to reach populations. You overlay that with your highest risk populations. So you might use the Social Vulnerability Index for that. It might be the people that you are seeing as most highly exposed to the virus because of their jobs, the healthcare workers and the critical workforce. You might look at the people who can become severely ill because of medical comorbidities or their age, people that are more socially vulnerable, as I said, and people who are more likely potentially to transmit disease because of their housing situation or their work situation. Of course, you can aggregate all of those to create a risk surface. And then you may add those access criteria that I mentioned before, whether it's a 30-minute drive time, a 15-minute walk time, to be able to calculate the most optimal sites for new vaccination venues. So I wanted to show you a couple of examples of things that people have done that I think can really support the vaccine delivery, particularly in making it more efficient or, well, probably mostly making it more efficient, actually. What you're seeing here is just some screenshots from Carleton County, Minnesota, who decided to use GIS for their drive-through flu vaccination clinic. So, of course, there's been a huge emphasis in making sure that people do get their flu vaccine, not because it prevents COVID-19, but because we certainly want to prevent hospitalizations for flu when we know there's going to be a surge in COVID-19. So anyway, Carleton County had this really great idea. They decided to use Survey 123 to pre-register people to come and get their vaccine in the drive-through clinic. And then they created a dashboard, and they even had the dashboard posted up as people were driving through this clinic so they could see the numbers as they did it. And they had 2 lines because there was certainly a line for the pre-registered folks who used the Survey 123, and then a line for people who had to use the manual paper forms because maybe they didn't get the survey or chose not to use it. But for the people who went through, first of all, the county said they vaccinated more people in one day than they had ever done before. There were very high levels of satisfaction. I don't know if you're able to read some of the comments on the side of that dashboard, but I will tell you, people said, easy peasy, very well run, great program, liked this for kids, right? Because they could stay in the car and stay with their parents. Wonderful process. And they said, do this for COVID. So it really helped. And it's a great way to set up maybe a temporary drive-through clinic to get to, again, those hard-to-reach populations or to take the stress off of the larger health systems. Now, if we go even a step further, we saw GIS used in the large-scale COVID-19 testing that was done recently in Slovakia. So again, it's testing for COVID-19 and not the vaccine, but I think you'll see the correlation. What they aimed to do was to test the entire population, adult population, over a couple of weekends in October. And GIS provided residents with up-to-date wait time information. And so that data really helped people to self-distribute among the different testing sites. And it regulated overall occupancy at each site. So there was better social distancing, less impaction, and people got through much quicker. So one of the stats, this was done in the Old Town area of Slovakia in Bratislava. And people got through within 30 minutes to 2 hours compared to over 6 hours in the rest of the country. So it really made a difference. It was a win-win for everyone, for those administering the vaccine, for the government, and for the population. And by the way, we've actually seen this work in the US, right? A lot of places used this kind of wait time information to guide the public during the election. Now, the fourth key task that we wanted to talk about is tracking and managing vaccine inventory, along with, of course, the vaccine distribution kits and the PPE inventory, because you need all of them to effectively deliver vaccine. So again, you know, this combination of mobile tools and dashboards is incredibly powerful. You can use Survey123, a mobile tool that can read the barcodes on the vaccine cartons, and it can automatically parse that information, because we know all of the rules behind that, into the relevant fields. So you get the quantity and the lot number and the expiration date. So it makes inventory check-in really quick and easy. You know, you scan the barcode, you've got the information. And of course, in the same way, inventory can be checked out when it's ready for use or transport. And all of that can be monitored in real time when you connect it with the dashboards. Now, the fifth major task area is around designing effective communications. And frankly, this is a really big one. Given the magnitude and the complexity of the vaccine distribution process, it's going to be really critical to stand up communication hubs that inform the public and different stakeholders about the current vaccination status across the state, across communities. Through that idea and that practice of transparency, governments can really enhance trust in the vaccine delivery system. And governments can guide residents to the resources that they'll need, like where and when can they be vaccinated in their particular areas. So in addition to these kind of broad and I might say basic or familiar communication efforts, we need strategic and targeted communications to help overcome vaccine hesitancy and increase the chances for what we all want, vaccine-induced herd immunity, to bring about that quickest possible end to the pandemic. And I do want to make the distinction between vaccine hesitancy and anti-vaxxers. Just because anti-vaxxers have very strong opinions, we're not talking about converting or persuading them. We're talking about providing the information to those who are unsure, who are hesitant, to get them what they need to make the best decision for themselves and their families. It turns out, no surprise here, that there's a lot of vaccine hesitancy at this point in time in America. So according to the Kaiser Family Foundation, 34% of Americans are not planning to take the coronavirus vaccine. And that attitude, I have to tell you, is even stronger among people of color. So we have to ask, what are the issues here? Well, if you compare the two donut charts, some of the key concerns, especially for people of color, are about safety, and they're feeling a lack of trust in the system. So for example, Black people surveyed weren't confident about the safety of the vaccines, And they doubted that the needs of Black people were considered at all in the testing and approval process. One person who was interviewed, I thought, said it very well, and so I will give you the quotation. He said, "If African Americans, Hispanics, and Native Americans are told to get vaccinated first, it'll be interpreted as you want us to be guinea pigs." The fact is, there's a long history that does support mistrust of the health system by people of color. So we need to work hard to get over that history and create a new path forward. That same gentleman was asked, what would it take to convince you to get a vaccine? And he said, I would think about doing it if I could see some other Black people associate with it. And so, to me, that means we need stories, not just data. We have to put a face on this to help people relate to people like them, like us. We all want to see what's going on with people like us. And so we thought about that, and we considered using a story map that would act kind of like the I voted sticker that people are proud to wear on election day. But this one is an I got vaccinated site so that people can contribute their vaccination stories. So this may ring familiar. Some of you, hopefully many of you, have seen that we've done something like this before. This is what it looks like. So this particular example is a crowdsourced story map where friends and family members shared stories of their loved ones that were lost to opioid overdose. We also have a similar crowdsourced story map, by the way, for people who have contracted and died from COVID-19. And in this story map, families share their grief while also making the data more real for everyone. The whole idea is to reduce stigma and taboo. And so we can see, for example, in this case that Brian Flynn from Boston, Massachusetts was a 26-year-old father and a son who will absolutely be missed. When thinking about this for vaccination, it might include, a picture of the person being vaccinated to give people a sense of people like us, right? Age groups, genders, race, ethnicity. And then you might encourage people to write a little bit about their experience receiving the vaccine. How painful was it? How sore was their arm afterwards? Was it like bruised for a day or was it 3 days? How did they feel after getting the first dose and the second dose? I think these stories would bring transparency again, and maybe even hopefully some positive peer pressure, levels of confidence and validation right to the forefront where people can see it. But I think there's another kind of communication that's really needed in this process, and that is, again, that strategic communication to overcome the vaccine hesitancy in a different way. Now, the CDC playbook, among others, has recognized that this whole topic of effective communication is essential to the COVID-19 vaccination program. If we're going to ensure equitable uptake of this vaccine, early and broad communication efforts need to focus on education, on dispelling misinformation, and on building that trust. So how do you accomplish this? You need data that helps you construct resonant messages and deliver them through the right channels. So I think that's a helpful idea. And actually, I'm just going to go back and show you, but Mike will show you more. I didn't point out that this infographic shows those channels, right? What is the primary couple of languages in a specific area? How do people get their news from a smartphone, from cable TV, from a newspaper, and what's their preferred social media? So you may want to be really specific about how you deliver these messages. And so that's where some of this marketing data that we have available through Tapestry segmentation can be very useful. Now, this is, if you haven't worked with it before, it's a marketing segmentation data set that's composed of 14 life mode groups across 6 urbanization groups, and it creates 67 population segment identities that help to tailor messages appropriately. We have this data available at the block group level across the country, so you can really get as specific as you need to be. And each segment has a 4-page information sheet that comes with it. So if we found that this group, the so-called Set to Impress group, was particularly vaccine hesitant in a particular community, then we might focus on the fact that this group tends to maintain really close family relationships. So an appeal to get vaccinated to protect your loved ones may resonate with them. We can dive into demographic breakdowns of this Set to Impress group to understand the level of diversity, their income, their predominant occupations that they have. And I especially like the market profile segment, because if I were running this, maybe I could run a campaign to reach this group through cell phone messaging, because they all seem to have smartphones and they shop at Walgreens. So I might want to point out that their local Walgreens does carry the COVID-19 vaccine. So using geography to target and tailor messaging for pockets of vaccine hesitancy, I think can be very effective. And I know I'm preaching to the choir here, but what I like the most about location intelligence in general is that it's actionable. Because as W. Edwards Deming said, without data, you're just another person with an opinion. So those are the 5 key tasks, but beyond those tasks that we've covered today, jurisdictions may have other needs that require location intelligence. So for example, we can help with tools for site planning and crowd management activities at your vaccination venues if they are really crowded. We have tools to help you track your supply chain if you need to redistribute vaccine in a way that maximizes efficiency, but minimizes the impact of any disruptions that could occur in that supply chain. And our solutions can also support things like health screenings for people who visit your various facilities. So I know you all know this, but whatever the location needs, particularly thinking about vaccines, I know that our platform can get you there. And so before I turn it over to Mike, I want to let you know what I think you can do. And that is, please help your state public health department. Connect with them if you haven't already. Do it today. Actually, put it on your list if you haven't, and do it today. Teach them about the value of GIS beyond making a map. I know a lot of my public health colleagues still don't get the breadth of what GIS can do. And if you have capacity, maybe you offer to assist or show them how and where they can get support. Connect them with us if they need additional software or professional services support. We'd love to engage with them. Let's work together to lift up our public health departments in terms of modernizing their use of technology. As you know, because it's been in the news quite a lot lately, public health has been underfunded for years. It's not their fault that they're behind, but it's caused many, if not most, public health departments to be technologically a little bit in the past. So your support could really mean the world to them. So I wanted to encourage you to do that. But before you call them, I want you to do it today, but not right now. I want you to see the live demos from Mike showing how all of these different tasks that I've discussed can be operationalized. So Mike, over to you.
Great, thank you, Este. Go ahead and share my screen out here now. Okay, so before I get started, I just want to quickly outline that the goal of these demos isn't necessarily to say that we have this turnkey solution, if you're familiar with those, for COVID-19 vaccine distribution. But what I want to show here is that all of these tools are very simple and easy to get up and running. So what I'm going to try and highlight here is that this ArcGIS platform is extremely flexible, and it can seamlessly support the existing workflows of your organization. So it's not going to be an all or nothing tool. If you see something you like, it will typically integrate with your existing processes. So you might use some added data sets from us to fill in gaps in your knowledge, or use some of these tools to ensure that you select the best sites for vaccine distribution. Or maybe you just use it for a platform for being transparent to the public. Este has very clearly articulated the need of that. So we can circle back around to that at the very end of this and see if we have some time for additional questions. So on my screen here, and let me know if you don't see it, we're looking at a dashboard. So the playbook from the CDC that was given to all the states, it contains a host of guidelines for training and for planning, but a major portion is dedicated to breaking the population down into those three groups or phases. And I'm sure you guys have been thinking about this a lot over the last few weeks. So phase one is dedicated to those who need it most. That's going to include your healthcare workers who are directly or indirectly interacting with patients. And then based upon your plan, this can always vary. It could be at the critical workforce in a slightly delayed phase. That could include everyone from food packaging to teachers to childcare providers. It could even include everyone over the age of 65 or in a long-term care facility. Now, phase two is going to continue the focus on those that have a heightened risk of severe COVID-19. So we're looking at those who are in university, those with asthma or diabetes, or those in group quarters, those without insurance, and that's really just to name a few. And then phase three is everybody else. That's the remainder of the general population. So that's everyone who's at a lower risk for severe COVID-19. So now in the example on the screen here, again, this is a dashboard in ArcGIS, and we have those dynamic charts and indicators of the total population, and even the ability to do on-the-fly ordering estimates for one or more vaccines. And in this case, we assumed 100 doses per order unit, and that can obviously be changed. But this vaccine also, or this also assumes that it will come in 2 doses. From a technical perspective, getting here wasn't a massive undertaking, and that's because we're leveraging a suite of demographic, socioeconomic, and commercial data directly inside of ArcGIS. So for example, ArcGIS users can come in and get market potential data to assess the percentage of the population that's using an inhaler or insulin or weight loss drugs. And it can also access traditional demographic variables like age. So now let's say that your location is extremely rural, and I know this question came up in the chat a moment ago or in the Q&A section. So if it's a very rural region, or maybe you had a massive displacement of residents recently. So think about the number of communities this year that had wildfires. ACS data and census data might not do the trick, just given the time lag. Well, ArcGIS can solve this challenge too, and it's actually been solving this challenge for years. We have workflows for rapidly sampling the population, similar to what we do with community health needs assessments, which we have a new solution for, or rapid health needs assessments, or point in time counts for homelessness. These are all workflows that, because we're in this one, and I'm getting in trouble for saying this word, ecosystem or environment of ArcGIS, you can have these data layers playing with each other. So it's all one environment to solve the same problem. And it's going to be very familiar to those groups who are using GIS now. So you can even use a survey in ArcGIS to sample people who are planning to get vaccinated, if they're planning to get vaccinated at all, and visualize that information spatially for outreach. Even within ArcGIS, you can directly tap into the CDC Social Vulnerability Index. And so that's going to help ensure that as we're planning this distribution at all phases, we're ensuring health equity. And you're going to see this data operationalized in just a moment. And all this information allows us to make these decisions both regionally, locally, even potentially nationally as well. It can be done here, and we'll give you access to all these demos at the end of the video or at the end of the recording here. So for all of these demonstrations, we're obviously making estimations because we are just using data from ArcGIS. Granted, it includes data from the census and from our market providers. But if your local jurisdiction has specific values on, say, the number of people within a designated workforce category, or individuals with certain health conditions, you're really encouraged to use that data to supplement this analysis. So you might say, okay, well, that number of healthcare workers isn't fully accurate for my region. That's great. You're encouraged to bring your own data to this. So now we're going to take this layer, and yes, it's a really great map to look at, but let's operationalize it. So we're taking this information to create a potential distribution network for just phase one here, and you can do every phase, obviously. So this is going to be serving healthcare workers and those residents who are part of the critical workforce and at the highest risk for severe COVID-19. Well, in the big picture, phase one is going to be fairly limited. And so we've used the tools in ArcGIS and a layer of hospitals from Definitive Healthcare, which is another layer in ArcGIS, to create the most strategic hospital locations that would serve best as a point of distribution. And I'm going to use the phrase pod throughout here. Now, as a reminder, again, that Definitive Healthcare layer, you can get it directly within the platform. So then for every single census tract, the tool goes through and identifies the nearest facility within 30 minutes of driving. And that drive time can be any threshold. It could be 1 hour, it could be 15 minutes, or it could be a different mode of transportation, like walking, or we've had some users that are interested in using it for public transportation, which is a possibility as well. So now once the tool selects an ideal site, it's not just doing it off of population alone. It's actually taking the phase 1 population and weighting it by the social vulnerability index. And it could be any index, like one focused highly on transportation needs. Or I know that NAPSG had recently a really great webinar on some other vulnerability indices. But in this case, we're just going to use the CDC Social Vulnerability Index. Now, what this means is hypothetically, if you had 2 neighborhoods next to each other, each one with, say, 10,000 residents, and each one had a potential point of distribution, the tool is going to place the point of distribution in the community with the highest vulnerability index. And that's how we're encouraging equity here. Now, this tool gives us a couple of outputs. Number one is that at any given facility, we can estimate the population that might be served by that site. And that demand is estimated here or shown here by the size of the circle of the facility. And we can even actually get a breakdown of the demographics at that site. So you can imagine how that could be very important during the planning phase. And number two, which is equally as important, we're going to get a listing here of the number of census tracts or neighborhoods, and it could be any geographic unit, that cannot access a distribution site within 30 minutes, highlighted here in red. So this is going to be very critical for both state and local leadership when making decisions. So for example, if the state is the one responsible for selecting the pods, they can take all of their providers who have applied for the vaccine and run them through this analysis to ensure that you have strategic coverage. But let's say that you're a local community leader within the public health department, and you're not the one responsible for selecting the pods. Well, you can still use this tool to find gaps in accessibility and target where you can place mobile clinics and where you can perform very targeted community outreach as well. And then additionally, like I said before, everyone's going to benefit by understanding which facilities are going to be under stress to serve the largest population, shown here again by that size of the circle. And we even see the vulnerability of the population surrounding that location. So this is really going to help with resource and personnel allocation. And it's also going to show us where you might want to add an additional clinic or a site to reduce wait times. And you could even see, like was mentioned in the Q&A a second ago, what the predominant languages are surrounding each facility. And that would ensure that you have the right staff on hand to provide the best communication strategy possible, location by location and neighborhood by neighborhood. Now in this sample region, we noticed that there are a large majority of individuals who can't reach a distribution site within the mandated time, which we set was 30 minutes here. And a lot of these are actually right on the state line. And so that highlights potentially the need for data sharing and interstate collaboration. And as I think everyone on the line well knows, that's something that ArcGIS really accelerates at. But let's say that we want to take control ourselves and we want to select a new location for a distribution site on the fly to cover these populations. Well, again, we can do that right here in ArcGIS, right within a web browser. So we can select a point of distribution and place it on the map, and let's zoom into a community here. And now we can see the additional population that would be served by adding that facility in. And again, because ArcGIS has this one environment of data, we can actually bring in data sets from other providers, like federally qualified health centers or commercial pharmacies, and seeing what the impact of these facilities might be. If you got a call, for example, in this case, of Walgreens, saying that they would like to apply to be a provider, what's the impact of that versus another? And you could automate this and do it at a massive scale as well. All right, so like Este mentioned earlier, GIS, it is going to be fundamental in the planning phase of vaccine distribution, but it's going to be equally as powerful during the operational phase. So this is when that vaccine finally begins shipment and delivery. So under blue skies, using paper and email and phone calls to monitor inventory, that might be fine, but that's not the case in 2020. Once the vaccine begins shipment, potentially in a few weeks, it's going to move very, very quickly. And there's going to be a need for the rapid tracking of inventory amongst multiple organizations. So think about the mom and pop pharmacies and the commercial pharmacies and clinics and dialysis centers, all of these things needing to be part of the same distribution strategy. ArcGIS can absolutely handle this requirement. And we have a suite of tools that include mobile apps that can run on almost any device out in the field, potentially even offline in the very back of a warehouse. and tie directly into your GIS. So in this case, let's say that I'm at a point of distribution, a vaccine has arrived, and now it's time to scan that vaccine into the inventory. Well, I can easily do that within Survey 123, which luckily has a whole host of support for a wide range of barcodes. Now, the good thing is that the barcode is expected to be standardized amongst the multiple different types of providers. So that means that we can parse apart that information on the fly, as you'll see here in just a second, which is going to give us the things like the expiration date, the exact timestamp of when that vaccine was scanned in inventory, and then equally as important is the person who's providing that vaccine or the vaccine manufacturer, which is going to be critical for inventory. Now, why I mentioned so clearly that everything here is timestamped down to the second is that once you break open that box of vaccines, the clock starts ticking depending on where you've put that vaccine in. If you're sending it into long-term storage, potentially it can last for up to 6 months, or short-term refrigeration, 15 days, or once you've opened it up and you started distributing from that box in regular refrigeration, might only last for 5 days. By using Survey 123 to scan in those inventory units when we break the seal and start distributing the vaccine, it's going to allow you to be extremely strategic with what sites need to move which exact vials of the vaccine first. And that's something that is, very cool to do in GIS. And obviously we can look at multiple different sites at the same time and get aggregate information. Again, we're just talking basic GIS here. Okay. So now we've kind of operationalized things. We've distributed the vaccine in this scenario. But let's hypothetically say here that now we've got the vaccine out and we're tracking those who are getting vaccinated. Well, we're going to start to see what Este mentioned earlier, which is that concept of vaccine hesitancy. And that's that growing pattern where for a number of reasons, some valid, people are going to elect to not get vaccinated. And maybe it's just a case of misinformation. And with the COVID-19 vaccine, there's going to be 2 doses, which is going to be very unfamiliar for most adults that are just familiar with the 1-dose flu shot. It's going to be critical that the population turns up on time for that second dose. But just knowing GIS, just knowing public health, that's not going to happen all the time. There's going to be specific regions where people, for whatever reason, aren't turning up for the second dose. Well, ArcGIS can actually start to do things about it. The first thing we can do is, for all this data, we can aggregate it into hex bins or any geographic unit that's going to give us specific areas where we can target interventions. And then we can highlight those areas that have the greatest concentration of those who didn't get their second dose on time, or maybe those who didn't get vaccinated at all. And at this point, we can start thinking spatially, like in these regions, did we remove a vaccination site between the first and second dose? Maybe there was a mobile clinic there and we moved it. And that disenfranchised some individuals, or maybe schools went back into session, or maybe we just need to trade our marketing hat on for our public health hat. So in ArcGIS, we can select any of these regions, and like Este mentioned earlier, we can create these infographics, which are really great for non-GIS users, and they outline the key factors of the community. And there's a whole host of templates, and you can modify these at any time. It's going to outline everything from their spending habits, to their socioeconomic factors, and even potentially their tapestry segmentation, to really learn what barriers exist and what messaging is going to resonate with these individuals. So in this example, we see that this is a community of mostly college-educated office workers, seen here as white collar, in their lower 30s. So then we also see the social media usage and the languages, a high English speaking, but with a very moderate Spanish speaking demographic. So just this demographic, as I fall into it, I could say, all right, if you want happy hour back, go get your vaccine. Or something more tangible is things like, yes, your children can still contract COVID-19. To protect your family, maybe you should go get the vaccine as well. There's a lot of different twists you could put on the marketing strategy. And again, this is something that you don't need to be a GIS expert to interpret. You can put this in the hands of your community health workers to interface with the community. And so while I used, again, that example of people not turning up for the second dose of the vaccine, the exact same workflow here would be great for targeting communities that aren't getting the vaccine at all. So, that's another great reason why you should be collecting location information at the point of distribution, so you can plot that information out. Again, we're in ArcGIS Pro, so we're using a very secure local environment to work with that kind of data. And once you have that messaging and you know how to structure your message to your target audience, well, you can now actually even create websites directly within our GIS, and we call these things hubs. And it's a great way to not just share your maps, but wrap everything in context. And we had a lot of success with this at the very beginning of COVID-19 when it was, wash your hands, wear a mask, where to find your testing site, where to find points of food distribution. So, this is, again, a very basic GIS concept that we're just reapplying for this context. Well, this is going to be the difference between just telling someone where to get their vaccine, which could be a mess, because if you type into the search bar where to get a vaccine and you get a point, you might show up at it and then get rejected. This is going to be the difference between that and telling them when they're eligible to get the vaccine, ensuring them that it's safe, and then when the time comes, directing them to the nearest facility with the lowest wait time. And again, because honestly, if someone's vaccine hesitant and they try to get the vaccine one time and there's a line, they might not come back. And again, we see this workflow already with elections, and that's actually kind of the workflow that we retrofitted for this workflow as well. So this example has a couple features to openly interact with both the public, and then there's also secure options for interacting with healthcare providers and your local health department staff. And everything is fully customizable down to the URL. So for the public here, we can show them the progress bar that outlines what our target is for vaccination. Maybe it's 60 or 70%. And once you get to that point, people are very encouraged. They see it creeping up from 50 to 60 to 70%. Really helps morale and encourages people to tell their neighbors like, hey, let's get vaccinated and get that bar up to where we need it to be. Everything is streamed in live from data sets, so it's going to be up to the minute. There's no sending it out, waiting for it to process, and the API sends back data that's 48 hours old. This is coming from the ground, which is a very great advantage of using these tools. And again, there's guidance here. So you could obviously post a link right here directly to finding your nearest vaccine site. But what we actually built out was a tool using one of our surveys, which is going to ask just a basic series of questions that helps you determine if you are eligible for the vaccine. And again, this is a PC, but this looks great on mobile as well. So if you were a healthcare worker, maybe you would say yes, and you're eligible for the vaccine during phase 1. But if not, it can ask other questions. If you're an essential worker, if you're over 65 or in a long-term care facility, or if you have a serious medical condition. And if you say no to all of those, based upon that factor, you might not be eligible for phase 1. And again, everything here is highly customizable, so you can put in your own criteria. But if you are eligible, you are prompted to view the map and even potentially enter in your email address to get future updates of where to get your vaccine, maybe some additional guidance. And likewise, if you put your email address in and you're not eligible, it could be an email alert saying, hey, we're in phase 2, come get your vaccine. Because again, we really do want to move quickly with this. So if you are eligible, you might see a map that looks something like this. And again, if you've worked with the ArcGIS election solutions, this is going to be very familiar. So rather than having polling places reporting their current wait time, now we're looking at providers being able to come in and provide their current wait time. And now why that's so important is, let me zoom into the sample area. If I lived very, very close to this facility over in West Des Moines, I see a wait time of 80 minutes. And again, if I didn't know any better, I might go to that facility and try to get a vaccine. Well, now seeing this cluster of areas with a lower wait time, I know to go to that location and get my vaccine faster, which is going to be very valuable. And you can also even just see the wait times in a short list here as well. Now, like I mentioned before, there are also other links for internal communication. One is for providers. So again, coming to the same URL, your providers can come in, sign in, create an account, which is then validated by your health department, and fill out information on their current vaccine wait time. There's even options for them to come into this tool and request assistance potentially. So maybe they've run out of masks, or maybe they've run out of the kits that are necessary, or maybe they just need additional assistance for crowd control. That's something that they can request here all in one system. And then all of the other applications that were mentioned earlier today on the vaccine phases and the evaluation of a new potential point of distribution, those are things that might be under this health department tab. And then the final thing, which is something that Este had mentioned, which is this concept of the community seeing their own face on the front of everything, is this idea of an I got vaccinated application, where individuals can come in and complete a survey saying, I got vaccinated, it was okay, I feel fine, and now I'm excited to get back to what the new normal is, which is, it's been a while coming for that. Well, that kind of concludes the demonstration portion. Thank you so much, and I'll turn it back over to whoever wants to take control here and answer some questions.
Great, thanks very much, Mike and Este. We've got about half of the questions have already been answered in the questions and answers, so please go ahead and look at those. But we have lots of good questions here. This is Frank. I'll paraphrase some of them. One of them is around spatial resolution, and some of the examples you showed block groups, but as we know, block groups vary in size and may or may not be at an adequate resolution to pick up really the local variations that we're after. And have you come across that? What's your solutions?
Yeah, so that's a great question. I think the stance that we often have is, we have curated data at a particular level and we offer that to people, but we know that at the local level, others have better data than we do and they can dive in deeper. So I would suggest if you have better data, use that. And if you don't have better data, but you need better data, then that's a really great opportunity to use mobile survey tools to start to collect that data. In this particular case, we have to always be cognizant of time. Everything's moving very fast, but that's generally the way I approach it. If you have better data, certainly use it. And maybe you'll find more granular data in some places on the Living Atlas. Otherwise, you may need to collect it, but we have tools for that too.
That's great. That kind of goes to Mike's comment about not having overbaked this. It's not a turnkey, all done for you kind of thing. It's a suite of capabilities that really get to those local differences. So thank you. Sort of related to that, another question is about local governments who are storing data that originates as HIPAA data in a geodatabase. And what are the pitfalls there? And is there a rule of thumb on I'll expand. So that's the first question, but then is there a rule of thumb on aggregation of that data so that it no longer has to be considered HIPAA because it doesn't impact any individual's privacy?
Okay, I'm going to try not to make this another hour response because we could speak endlessly on this. And also, Mike, you're going to have to get on camera too and respond in case I say something wrong. But basically what I would say here is that the rules around protected health information are somewhat different in an emergency. So important to be aware of that. But I know nobody wants to be a headline. Nobody wants the bad news. So we're all going to be as ultra conservative as we think we need to be to protect our departments, our state, our people, and of course that health information. So we understand all of that very well. So there are methods. First, I would say, I know there was a question about the Carleton County example and pre-registering for their flu clinic. And I don't know the details of what they actually did, but this is where I need Mike to, shake your head or say, no, you're wrong there, is if you use your Survey 123 through your enterprise GIS and you've got Portal, then you have some additional protection there. If you want to use it through ArcGIS Online, then you might have to use other kinds of methods, like maybe people putting in some sort of a code or something that you can match up later to their actual name to put into their health record system, because we of course want to be able to record that they got their flu shot. So you may have to be creative in some things if you're using just ArcGIS Online for this. So I'll pause to see if Mike wants to add anything there.
Nope, that was exactly it. A lot of the cases, what we're seeing is people aren't necessarily putting the patient level information directly into the GIS. It's just saying that an individual was vaccinated, and that's how you get these really great tallies and real-time numbers for public consumption, and then using some kind of key to tie that back to your immunization system where the PHI and PII is stored.
Yeah, and remembering that not everything, in fact, most of what we showed is not protected health information. So just because it's health doesn't mean it's protected health information. Now, you asked about rules of thumb. So very quickly, I will say that in one way, it's complex. In another way, there are methods. So there are certainly methods of aggregation and blurring, and you can get to finer scale mapping if you don't aggregate necessarily by political boundaries, but use something like hex bins or fishnet grids or any other shape of tessellation grid that you like. So that's one option, but then your question will be, well, what size then? And so you need to do some statistical analysis to figure that out. We do have a partner, if you're not aware, called GIS Inc. And they've created a tool called MapMask, and it's written as one word, MAPMASQ. And that tool works just like an extension to ArcGIS Pro, like any of the other extensions you use. And it'll help you to do geomasking and some of those aggregation procedures. And what it does that is special, that's not built into our platform currently, is it provides you the statistic that you need to decide if it's within your organizational governance around privacy. Let me give you a quick example. Maybe you do some geomasking and you move actual points around, and you will return from the MapMask tool a k-anonymity statistic. And we know, for example, that the NIH says that k-anonymity over 5 is pretty good. So if your organization says 5 is good for us, if it's good for the NIH, it's good for us, then you can manipulate your geomasking procedure to that level. So all I'm saying is there are methods, there are statistics, and there are tools that will help you. I kept it under an hour.
Nice work. Yeah, so again, more of these are being answered right in the questions and answers. One of those that stands out to me is have organizations implemented parts or all of what you've shown today, and some of their success stories would be great for us to share.
So that's a great question. I will sort of limit the concept of success stories since there's no vaccine out yet. So a little hard to measure, but I will say that this is an ongoing conversation with a number of organizations. I'm told I can say this, hopefully there's nobody who will tell me that I'm wrong, but we have been working closely, and probably one of the most advanced states in implementing some of these ideas is Alabama. And so we could look to them as an example. And then, like I said, we've been giving you examples of things that are in practice, like Slovakia and Carleton County, that are not directly COVID, but they are related. So we know that it works. So yeah, number of states, the one I think I can mention safely is Alabama. So go Alabama.
Yeah, and I will interject there as well and say that, again, these are very basic functionalities that we've been successful with for several years of election management and point in time counts and community surveys. So in successes for this, kind of look to the past a little bit.
That's great. Thank you. So another question here, I'll paraphrase, and is NSGIC, Esri, state and federal agencies committed to sharing vaccine location information openly? And the question goes on to talk about having to foil organizations to understand other parameters around the pandemic. So just on behalf of NSGIC, sure, NSGIC generally advocates for availability of data, but responsible availability. And I think Mike showed some good examples of people that may discover data outside of the context of the system we're trying to build might be disenfranchised. But that's where open sharing and responsible sharing is kind of the next step of maturity. But other perspectives on the open sharing of vaccine location data?
Yeah, so I would say that Esri's position is probably very much like NSGIC's, that we always advocate for sharing when appropriate and doing it properly and safely. And we're happy to partner in those endeavors. I would put it back to the people on this call and say, we both maybe believe in this, but how can we do it louder? How can we be more influential? Because I'm guessing the question is coming from the fact that not everybody is hearing or believing in this message. So how can we use our partnership and our common belief system to really get the message across that we can do this, we can do it in a safe way, and it benefits everyone. I often point to the Johns Hopkins University dashboard, not just the dashboard, but the data sharing. that enabled the entire world to use an authoritative data set for their own applications and how valuable that was. So we should point to that example for what it could be like for vaccines.
Yeah, that's great. That kind of sharing that scales is really what we're after there. So this may have been addressed, but it bears repeating. Another question is about how do GIS professionals keep the data secure? And security is certainly paramount.
Yeah, I guess what I'll say is you can Google navigating HIPAA in a geospatial world to get information about the HIPAA question, but security goes beyond HIPAA and protected health information. You all know that. Even if you look at HIPAA, there's a privacy rule, which is what that webinar focuses on. So de-identification of personal information. But there is an actual security component to that too. What does your system look like? How secure is that system? So I think from the point of view of what can folks from NSGIC do, be familiar with the trust.arcgis.com website. Know what are the limits of the software and where you need to make adjustments, and know how that compares to your state's governance procedures. And where we need more information, if you have feedback for us, let us know, because we're constantly working on hardening the security of our systems to make them most useful for you.
That's great. And I see Mike's URL in the chat to that. So thank you, Mike.
Thanks, Mike.
Another question is related to the vaccine inventory, so the supply side and the rates. And is there a data source besides the operational data sources that you've demonstrated here?
So how about if I pop that to you, Mike?
Not directly integrated into this example. That being said, if the state was able to export any kind of flat file or permitted you to access their API for any kind of that provider data, it could easily be loaded into ArcGIS for a number of different methods, either scripted. We have analytics for IoT, which can bring that data in as well. So if that's something you want to dive into, feel free to connect with me after this call, and I'll drop my email into the chat window.
That's great. And that does bring us towards the end of our allotted time, I believe. But I think most of our questions have been pretty well addressed, and I really appreciate the time and the thought and the story you put into this, because it really is more about telling the story than about the technology, and this really empowers a lot of us. So really appreciate the effort you put in. Molly, Este, Mike, I'll turn it back to you for any final comments.
Well, we're only doing all of this so that we can see you all in person again.
I love it. Absolutely.
Yeah, this has been great. Thank you so much, and definitely respect the work you all are doing, and very excited to be a part of it. Thank you.
Yeah, thank you. And I'll just chime in and kind of close this out here. This is Molly again. Just thank you so much to Esri and Este and Mike for providing us with all of this great insight and information. And we will be following up. If you registered for this webinar, we have your email address, and we'll be circling back with you to share the link to the recording and other information and follow-on discussions. So thank you all so much for being with us this afternoon, and we look forward to continuing the conversation.